Hi, my name is Jen Bullock, and I'm the nurse practitioner on staff here at Illume. And today I wanted to talk to you a little bit about the O shot. The O shot is one of my favorite procedures to be able to perform because it's had such a phenomenal impact on my life. It is a procedure that we use to treat things like stress incontinence and lichen sclerosis or dyspareunia, which is painful intercourse. It also is a wonderful procedure that really has been used. It's famous. It's called the O shot because it has some really nice side effects and benefits as far as increased sensation and desire and intensity of orgasm. For me, I was drawn to the procedure primarily because I've always had issues with stress incontinence. You know, I'm in my late 30s and I have had a child, and you know, you go to jump rope or you sneeze or you go to the gym, you know, you're lifting weights, you know, you cough too hard, anything like that, there's a little bit of stress incontinence. And for me, that was my primary reason for wanting to learn more about the O shot. But as a nice side effect, it immediately takes care of stress incontinence. But as a nice side effect, it also does increase sensation and desire and intensifies orgasms. And it's probably, for me, has been really profound treatment. So the O shot is we draw your blood and we spin it down and we isolate all the platelets and growth factors and cytokines, all the chemical messengers that instruct your cells what to do. Now, we've been using PRP in orthopedics and sports medicine and in veterinary medicine for 15, 20 years, but it's really just entered into the aesthetics world and sexual health over the last 5 or 6 years, and has really gained popularity and momentum. It's natural, so we take your blood, we spin it down, isolate all those growth factors, and then anywhere that we inject it, we're going to see regeneration of tissue, because we're taking all the little messengers that tell your cells what to do, and we're putting them directly into an area of injury. So, whether that's the anterior wall of the vagina, which is, where your urethra sits, and also the area that's known to be our G spot, or we put it into an injured knee, we're going to see regeneration of the area there. So a lot of times stress incontinence or vaginal laxity, decreased orgasms, all that stuff has to do with decreased blood flow. So we do 2 injection sites for the O shot, and it goes one into the anterior wall of the vagina and one into the clitoral tract. We use, it's very comfortable. Most people don't feel a thing at all. We use a little bit of topical lidocaine as well as some injectable lidocaine, so that it's really, really comfortable. The procedure takes about an hour from start to finish, and you'll leave immediately. Should relieve any issues with stress incontinence, and then also you can resume sexual activity within a couple of days. I think you'll feel a little bit of fullness in the vaginal cavity for just a day or two, and then that subsides as your body absorbs the natural, just sort of absorbs the PRP, and then you can resume all normal sexual activity, and it'll just get better over 4 to 12 weeks, and generally you just need 1 injection. Maintenance is usually every 6 to 12 months, depending on how much it's just really independent. But if you want to learn a little bit more about the O shot, or if it sounds like something that you're interested in trying, I'd encourage you to come on in, schedule an appointment with me, make sure we have a good rapport and that you feel comfortable going through with the procedure. It is important that you see a provider who's certified and registered. There are other people out there that are doing these procedures, but for your safety, and you want to make sure that you have a certified registered provider, because then it ensures that you're being treated by a qualified individual. If you have any questions, just give me a holler.